Okay, the Patient Protection and Affordable Care Act, or ACA, a historic overhaul of the American healthcare system, focused on increasing access to health insurance by 1, controlling and expanding the sale of insurance on private markets, and 2, broadening the Medicaid program to include all Americans up to a certain household income cutoff. But in the last 8 years, the law has become the cause of and cure for everything good and bad in American healthcare. It's been damaged by persistent confusion. In early 2017, a full 7 years after its passage, 35% of Americans either thought Obamacare and the ACA were not the same legislation or didn't know whether they were the same. The ACA has become a mythical unknown, like a piece of abstract art. To some, the law is not improving physical health nor finances, but others see that it has saved lives and is reducing medical bankruptcies. It's become an illustration of our fragmented healthcare delivery system, mirroring our divided politics. It is the ultimate inkblot test. And one can understand that reality. It's a complicated piece of legislation. It impacts many corners of the American healthcare system. And it's an amalgam, not a narrowly directed piece of legislation, but an attempt at a cure-all, bringing a number of proposed policy solutions to a complicated set of problems. Some have worked and some have not. American healthcare is complicated. 50% of us get insurance through employment, 1/3 through Medicare or Medicaid, determined by income and age. That leaves about 7% who get their insurance through the private marketplace. All the rest are uninsured. The ACA made different changes to different types of health insurance. And then the Supreme Court changed everything. The ACA had initially required all states to broaden their Medicaid programs, but the court, in a major 2012 decision, invalidated the mandatory nature of expansion and it became voluntary. As a result, instead of as many as 18 million people gaining insurance through Medicaid, only about 12 million have. 34 states and DC have expanded their Medicaid programs or have started the process of implementing expansion. 3 additional states voted on Tuesday to expand their programs. 14 states, including Tennessee, have not. This is the case even though the federal government shoulders the majority of the financial burden involved in covering more individuals. The other focus has been on the 7% of Americans who purchase their own health insurance, and particularly on the roughly 3% of Americans who get their health insurance from the health insurance exchange. This marketplace was maligned in late 2013 when its websites failed, but Obamacare is not just a website. Recognizing that many on the private marketplace could not access health insurance due to chronic conditions, the ACA outlawed insurance companies' right to underwrite or to exclude certain individuals from insurance due to their health care risks. Now all individuals with pre-existing conditions have a protected right to purchase health insurance. We're all in the same risk pool. But these marketplaces have wobbled. Uncertainty and undercompetitiveness have plagued the marketplaces, with vast portions of the country serviced by just one insurer. Monthly premiums have increased rapidly in many markets. Without robust competition between insurance companies, hospitals have been able to set prices with impunity. Because those plans on the marketplace also receive federal tax credits, that is, the majority of those purchasing health plans on the marketplaces receive assistance to purchase them, when premiums increase, the majority of the financial burden is shouldered by the federal government, not the 11 million individuals who purchase insurance on the individual exchanges. In short, the ACA has made a positive impact on healthcare access for individuals. The uninsured rate in the country has plummeted over the last 5 years. If the ACA has a positive impact on American healthcare, it is undoubtedly surrounding its access gains, and it has improved public health markers as well. Few can argue with that. But American healthcare, the crisis, extends beyond a failure of insurance access. The other challenge facing American healthcare, a challenge that the ACA did not adequately address, is the cost of American healthcare itself. Indeed, a government can successfully help provide subsidies to its citizens to purchase insurance so they receive access to care, but as the price of healthcare increases, that insurance gets less effective at shielding the patient from the cost of her care. Because America does not regulate the price of healthcare, nor empower one payer to negotiate on behalf of all patients, the system in the US struggles under the burden of particularly high prices. And we all know that the US has a spending problem as compared to our international peers. The US spends more than $10,000 per year per patient, more than double the comparative country average, more than Canada at $4,700 per year, more than the UK at $4,200 per year. We spend roughly 1/5 of our GDP on healthcare. President Trump and congressional Republicans promising repeal and replace in 2016 didn't have the votes in 2017. Instead of repealing the ACA, the Trump administration has used its executive levers of power to change the inner workings of the law. These changes have made the ACA both more expensive and more brittle, putting its long-term sustainability at risk. The Trump administration has also given more discretion to states to determine future health policy. States have increasingly attempted to escape from the strictures of the ACA's tighter rules around the types of health insurance plans that are allowed to be sold. Other states are seeking to impose work requirements on recipients of Medicaid. In terms of policy specifics, changes made under President Trump, the repeal of the individual mandate, the cancellation of cost-sharing reduction payments that had assisted patients in paying for medical bills, and cutting the length of open enrollment during which individuals purchase plans have damaged the ACA's internal gears. And all of these changes exacerbate the pricing crisis. When hospitals treat uninsured patients, they have to cost shift. They have to raise prices, like prices for an arm x-ray or even the price of a Band-Aid. Pharmaceutical companies also contribute to this crisis through the high list prices of EpiPens or pharmaceutical drugs. Legal interventions have not succeeded. So, what to do with the ACA? The Supreme Court swung at it, so did Congress. Regulatory challenges have damaged it, and its long-term success is tied to its ability to continuously shield Americans from the cost of their health care, which continues to rise. Now, just past its 8th birthday, health policy experts are wondering, how many lives does the ACA have? Thanks.